8 years ago, we started a wellness company called Health Check 360, which is, we did it in response to what we saw as a need in what I would describe as the middle market space. There were some providers in that space, but they were wanting to work progressively with larger and larger companies, and they kind of walked away from, kind of what would be our bread and butter. So today that company does biometric screenings on about 85,000 people per year, and we work with employers all over the country, literally. So that's one part of it, and then some of what we're doing with those screenings is feeding the information that we learn about the people to help get them into programs to help them manage their chronic conditions better. So you talked about the double stuffed Oreo. Everybody wants more double stuff, and
I just want an Oreo, period.
Yeah. So oftentimes we're passing the people that we identify in the screening process to a higher level of management. But then from the sort of the insurance end of it, where we're interacting with employers, we've got over 700 clients today that we serve around the country from an employee benefit or healthcare perspective. So the design of how corporate wellness programs work and how they're implemented and how you structure the rewards and whatnot is something that we spend a lot of time thinking about. So where we're at today with technology in particular, I think you asked me for some things that you would see in 2016 and maybe some of the near-term future, but maybe not immediately on the wellness topic, but I think something that is going to be tangible and evident to everybody, if you haven't noticed already, is going to be the massive proliferation of what I'll call telemedicine or telehealth. And that's a fairly broad subject in and of itself, but you may see ads now for University of Iowa Healthcare. They've got a service that you can log online and do a consultation. And historically, most of the delivery of telehealth has been through an employer-sponsored plan where people had to be attributed to one provider or another. We're seeing an absolute explosion of interest in that, and a lot of the stuff, where we are in the Midwest, a lot of things happen on the coasts and then kind of bleed inward. So we're seeing the uptake rate on these types of programs is tremendous, particularly with the annual renewal cycles that are going on right now. That will, so just the whole use of technology, people can actually use their smartphone and have a video consultation with a physician on the other end for chronic conditions, nuisance type conditions, things that are, the kids that are having the recurring ear infections, the things that you kind of know what they are, that are fairly easy to flesh out, is really kind of what telemedicine came to the marketplace doing. But as you look at the population aging and the proliferation of chronic disease, how you help people manage those chronic diseases very much lends itself to telemedicine, in that rather than having to go to a physician's office and have an office visit just to have them check up on whether you're taking your medications or not, quite easily can be replaced with an interaction that's electronic and at a much, much lower cost. The other reason these things, there's two main reasons why it's proliferating. In addition to that, it'd be a lot of employers are moving to higher deductible health plans. Everybody's aware of that. So if individuals have higher deductibles, they're more financially in the game now. And with telehealth visit, how much that visit's going to cost before you have the visit. The next main theme, I think, in technology would be everybody's familiar with, I think we're kind of behind on what he's doing with the cows, but everybody's familiar with Fitbits and Apple Watches and all these devices that track activity, right? And it's very pragmatic today. The Fitbit everybody's familiar with, and the Apple Watch and things like that. So you can actually use these monitoring devices to feed into corporate wellness programs. I'm not necessarily an advocate of programs that reward activity-based incentives, but a lot of employers are doing that. Mm-hmm. So they may say, in order to achieve a preferred contribution status, you need to have so many steps a week, and you've got to log in, and so you can integrate these things into the way that the benefits are structured, right? you know, if you take then, you know, the further looking down the road, I mean, there's all kinds of really interesting things that are in development that aren't quite here yet with, you know, development of technology like being able to monitor people's biometrics remotely from, you know, a device that they wear on their wrist. Or I read that AT&T is developing a shirt that'll be able to read all your biometrics. You know, these things are going to go from being on a wrist or on a you know, your phone to being just embedded into your clothing. And then, you know, there's a contact lens that's being developed that's supposed to be able to read glucose levels in diabetics and transmit the information electronically. You know, those are the kind of space-age things that are out there, but they're coming. And so what's the intersection of that with how you manage a health plan is interesting. And, you know, like agriculture, you run into a lot of regulation and a lot of ethical questions as well.